before we start, the assistant's gonna punch the dam now that we know which tooth that we're working on. You can use the template if you need it. Remember that this is just gonna be a single tooth isolation. So you just go in. A lot of times they'll eyeball it. You're gonna use the appropriate hole, size hole for the tooth that you're working on. So just review that if you need to review that. Again, you could use the template to punch it if you need to. And we'll put that off to the side, that way that doesn't get contaminated. Now there are two ways that this can be done when we get to that point. It can be placed with the dam and the clamp all as one, or we can place the clamp and then place the dam after. And we'll talk about that more when we get to that point. So we're going to get ready to dry and anesthetize. Thank you. So we'll dry that area. Thank you. Topical. And then underneath the chin so the patient doesn't pass out on us. We're going to anesthetize them. Okay, why am I shaking the cheek?
I just had this done to me yesterday to distract the patient so they
Right,
don't feel
just to kind of distract them so they don't feel that pinch of that, and that pinch in the burn of the anesthetic on them. We'll do a single-handed scoop technique. Remember, the safest place to secure that is right here at the hub. That way you don't chance that that needle's bent or poking out anywhere. Okay? So now the patient's been anesthetized, we are going to isolate with the dental dam. Okay? So with this, again, there are two options. You can place the dental dam and the clamp all as one. The thing I will caution you about that is, I think I told you the story that in my office we almost did the root canal on a wrong tooth once, right? So you can, they would sometimes mark the tooth with a Sharpie, put a little Sharpie mark on the buccal. So you could do that. Or, so you do this, you'd have to mark your tooth or do something to make sure you're getting on the right tooth. Or you can place the clamp and then put the dam around it, okay? Remember, when you're placing the dam, you want to place the clamp on the lingual first, and then on the buccal, and make sure you're staying on the gingiva. And give it a little tug to make sure it's secure. You might need to lubricate this possibly. So we're going to bring that right around. Can I have the whole punch back, please? I used the 5 last time, that seemed to work better. Thank you. It was actually easier from over there when I did it this morning. How do you do it from over there? This morning I sat as the assistant when I did it, and it went on much smoother, so we're gonna have Mrs. Santos do it from there. It rip.
He also had less teeth earlier.
We didn't use him this morning either, he's not so fun to put the hair in.
Yeah, you can't feel anything.
It does
I
have
got
to do with the tone.
Novocaine and topical, and then put like 3 different local anesthesias, like right, oh, you could feel it like going through down here, and you can't feel anything after. As soon as he starts capturing the teeth, that's all you think about.
Thank you. So we're trying a little something new with you guys, because this guy has some root canal teeth. This morning we used the regular wax teeth. So we're finding he's not as easy to get the dam on. So with the dam, you want to make sure that the tooth distal is completely covered, so the only thing that we should see is that tooth that we're working on, okay? So you want to make sure that there's no leaks or tears in the dam, because if any saliva is coming up, then our irrigation solution could be going down. If it's covering your patient's nose, sometimes they'll cut it, sometimes they'll just fold it. Making sure your patient can breathe is important. So now we're going to get our ligation through. And we got it through. Alright, so now we are ready to get started. we're gonna start by making our initial access, so we have a round burr. So you can see Mrs. Santos has the HDE and the air water syringe. I'll just cut through the real big one, go through here.
It didn't want to cut very well anyways.
I'm gonna bring you down a little bit.
It didn't want to cut very well.
So it's probably totally down a little bit. Just do one of them. Just two. I don't know if there's two or three. You can go see if you can video over there. Alright, so we've made our access. So what's missing in that picture? Right, so the operator and the patient should both have on safety glasses. So now, when we look down into the tooth, we can see the canals, okay? So now we're gonna start to do the pulpotomy. So we need the Endo Explorer to locate the canals. And then the Endo Spoon, and she's got the 2x2 with the Endo Spoon, because now we're gonna start to remove some of that coronal pulp. Okay, and then the next thing she's gonna pass me now is a brooch. Can we use the brooch again? Can we use the brooch again? No, they're single-use disposable, right? Where are we gonna discard it? Right, in the sharps container. So sometimes, remember, they can get, a piece of the pulp will come out kind of all whole. So this is doing the pulpotomy. So she's gonna have 2x2 ready to take that back. And then now we're gonna go to the Gates Glidden, which we already have loaded here. So remember, you can tell what number these are by the number of rings on them, okay? So this is a number 4 Gates Glidden. They will typically start with a lower number, like a 1, and then work up to the 4, okay? This is gonna help to widen and enlarge the canals. So Mrs. Santos, the assistant's gonna swap out to her smaller section. It was all worth it with the dental dam. You can see the tooth is inflamed because the pulp is bleeding. I'll have you come look in a second, let me get a little more. Yeah. Alright, so Mrs. Santos has her small section. Are you excited?
Yeah.
It's so lifelike.
Mhm.
It's so lifelike. Okay, I want you to come take a look at this. So be careful because I have these here, but this is very lifelike. So once they get into the pulp, can you see if you look into the mirror? You can see down into the tooth. You can see the canals,
Oh, looks so cool.
and it's bleeding. It looks just like the picture up there.
Mhm.
So exciting. That made my
Yeah.
day. My day is made. Oh darn, did I lost it?
Mhm. Sorry.
It's even like little matter. That's amazing. Okay. I'm so excited, I'm sorry. I'm totally geeking out about this. Alright, so at that point you usually irrigate. So we will irrigate that tooth. So she filled up the irrigation solution. You know, you take off the cap, right? I'll show you. So what is our irrigation solution most likely?
Sodium hypochlorite.
Right, so it's a mix, right, of sodium hypochlorite and water. Did I put this on or did you? Which thing you did? Hercules. Okay. So remember when they're irrigating, that sometimes they will tell you, it's so cool. Sometimes they will tell you to leave a little bit in there so you won't suction it all out. You'll leave a little bit of the irrigation solution in there because it helps to break down the pulp. Other times they're going to tell you to dry it, so I would irrigate and she'll go right over and dry. Okay? So cool. Sorry. It's the little things in life, yeah. Alright, so now that we've accessed the canals and started our pulpotomy, we're going to get a working length. Okay, so we have that estimated length from the pre-op x-ray that we've been working at. We want to get an actual length of this tooth. So when we took our initial radiograph, we held up the file and got our initial length, and we are working at, it was 18 millimeters. So now she's going to give me an 10 or a 15 file. K file is normally what you'll get the length with. So we're going to put that inside the tooth. And we're going to take a working x-ray, okay? So now the assistant will fold up the patient's bib because this side's contaminated, the underside is not. The doctor usually leaves the room at this point. So she'll fold up the patient's bib. She's going to place the lead apron on the patient. I'm okay, I'm okay. And then she's going to take the radiograph. So this is called an endo ray. So this is made so that you can take the radiograph and the patient can bite down and there's a spot for the files to come through. Okay? The alternative with this is that the patient would have to hold the film. So she's going to place that around the tooth. The files will stick out of that part, but yet when the patient bites down, they won't bite on the files, they'll bite on the endo ray. Some of them do have the ring that you can put on there, okay, and some are going to do it freehand. So they'll have the patient bite, you'll get the PID, you'll expose your radiograph. She knows that she got a good quality radiograph, she can see beyond the x-ray, beyond the apex. She'll go get the doctor and let them know. Now when the doctor comes in, we're going to see that we're a little bit short here, so we know that we need to do a little bit more work to get to the apex of that tooth. Often this is left folded and left on the patient's lap or on their legs, and we confirm that the patient doesn't mind that we leave it there because we'll be taking additional x-rays. Patients never minded, I was saying this morning, it's probably because it's weighted, right? And now we know that like weighted blankets help to calm patients, so they probably actually like the comfort of having that weight on them. Very important that the hand pieces are always facing this way, especially with burrs like this in there, because somebody could get stuck. When you're working with an endodontist, they're often working six-handed dentistry, so there usually is another assistant over here, okay?
Do endo offices usually have the X-ray unit in their
Yes,
where they work?
they'd have to have it in their room, because they're gonna take several x-rays during treatment.
What would the third assistant be doing?
They're going to be changing the burrs. When they get to the part that you're gonna obturate, they're gonna be passing some of that instrumentation. So each canal, depending on how many canals are within the tooth, each one is gonna have their own working length. So if you have 4 canals, you might have 4 different lengths. Or they could have some similar, like 2 could be 17 millimeters, 2 could be 18 millimeters. A lot of times they will write it on the paper here. So you'll have a pen or a pencil that has a barrier around it that you're using to write. So now that we know we're working with 18 millimeters, we have the option to either get this all set to 18 millimeters, or they would go and retrieve a sponge like the one I showed you before that's already preset at 18, 19, 20, 21, so you could just grab it, and this one would go into steri, okay? And they'd grab the sponge that's already set. That's what that other assistant would be doing, could be doing also. So now you're gonna go in sequence the while you ran blue, grab, black. So I have the white in here already. Remember we talked about sometimes that they'll use a lubricant, so this one's called File Ease. So if they wanted to use this, they could squirt some of this here, or they might have it in their finger ruler, so that you could run the files through that if they wanted to. Now she has a, she has a wet 2x2 with alcohol, so that every time she gets a file back, she's gonna check right to make sure that it's not unwinding, that it's not breaking, and that it's at the length. So if I wanted to, I can run it through this lubricant. Now the operator is going to have a ruler as well, either on their finger or on the back end of the mirror, so that they can check them too. So I can double check them also as I get them. So now we're going in sequence while you ran blue, grab, black, okay? So you can see that push and pull in each of those files, each of those canals. Now, to at what point file they'll go up to, that's the SOP of the office. And it can depend from tooth to tooth. So they'll usually let you know that they're gonna stop at 40 or stop at 45, or they're gonna need a 50, they'll let you know. So we will stop at 45. So we're gonna end on 45, which is white. Ooh, I got more blood. So that means I got further down than we had before. We're still getting bleeding at the apex. So exciting.
Order 'em up.
I wish I had your face on camera for that one.
It's My happy face. I'm so excited. I love when things actually, yeah. It's so,
Maybe they have the bloody the bloody.
it's so lifelike. Look,
cancer
and you can
agents.
see matter, like you can see,
That's what it would
like,
actually look
that's what it would look like. You can see that like pulpal tissue on the,
That's so cool.
you'd be actually wiping that off. So,
Made the day.
seriously. Okay. So we went through our sequence, so you're gonna set the files to the proper working length, you're gonna be ready to pass and retrieve them. As you're passing them, you're going to hold below the stopper, because remember the stopper is going to be at the correct length, so you wanna make sure you're not pushing the stopper. You're gonna hold it below the stopper with the sharp end facing you, handle facing the operator so they can grab the handle. You're gonna have your alcohol wipe, so you're wiping them down. You're turning them to make sure that you're looking for a shiny spot, that it's not unraveling, because then once it unravels, it gets weak and could break. Return it to the same exact place in the sponge so that if you need to retrieve it again, you know where it is. Or if the operator needs to go and retrieve it, they know where it's located. You follow the SOP of your office, obviously, until what files you're gonna go up to. And what lingo they might use if it is broken. Usually the lingo that we used in our office was that it was short. If it is shiny and unraveling, you have your trash cup, so it's going to go in there, and then you usually have a supply sponge that you would refill it from, or this other assistant's gonna grab you one, okay? And there are many different styles and techniques to do this. So while you're using the files, you'll irrigate and dry, so we can irrigate and dry again. And I'll ask her to dry completely. And now they can pass the headstrums and go through the headstrums in the same color sequence with the alcohol wipe, passing below the stopper, that same sequence. And that's called backfilling, okay? Now, remember in the PowerPoint I showed you that other slow speed handpiece, and somebody asked and said it looked like a lab engine, so it did look like a separate whole system like that. One of the brands is called Pro Tapers, so I had a picture of that in the PowerPoint that they were color coded also, so you followed the same color code, but they're rotary instruments. So that replaces doing all of the hand filing. So most endodontists are gonna have that system set up so that you'll use that, so it saves them from having to do all the hand filing, carpal tunnel, right? This is what they do 10 to 12 hours a day. The more they can do with rotary instrumentation, they're gonna save their hands, okay? Now at this point, we've done the pulpotomy, we've removed some of the radicular pulp as well. We have some options. They may complete the root canal and fill it and close it up and the patient's done. They can temporize right now and have the patient come back. So sometimes if it's say we got into a difficult situation and the canal is calcified and it took us much longer than we thought, we have other patients scheduled, we might need to have the patient back, so we might need to temporize and have them come back. If the patient was an emergency and this tooth was really bothering him and we opened it and there's a lot of bleeding and the tooth was really hot, right? If we put a filling on this now, if we put the cavity in there, this might cause a lot of pressure to build up, like capping a volcano or a bottle of soda, right? You can feel that pressure build up. So they might leave the tooth open for drainage. So they leave the patient with this open hole in their tooth, instruct them to chew on the other side as much as they can, avoid foods that are really small and hard that could get into the tooth to block a canal, popcorn, sesame seeds, poppy seeds, strawberries, things like that. Anything with seeds or nuts that could get stuck in there. They're sometimes sent home with an irrigation syringe so that they can help to irrigate if they do feel like they got something caught in there. And then they usually come back within a day or two to have this completed, okay? Today, we're gonna say that we are ready to complete this root canal. So we're gonna irrigate and then dry our canals. Now, there's a couple of different ways we can do this as well. So one of the ways is with these unit dosed cotton paper points, and the other way is that we would pass back and forth. So we'll show you this way first, that she would load this, she would have it to the correct length.
That's where it gets soft, right? If it's still wet.
So I'll
Yes.
confirm that we're to the right length. I'm gonna put it in the tooth, and I'm gonna check, and if we need to make sure that we're dry, so I know that that's obviously wet, okay? And then I would just give those back to her, and we keep passing like this, okay? So that's one way we can dry. The other way is that she holds the packet, and she holds the cup in the same hand. Let me take this on this. So she holds the packet between the pointer and middle finger, and then she can hold the cup, and we can grab back and forth, so I can take them right from here. This is personally my favorite, but it's the one that the endodontist that I work for did, so it's the one that I'm most familiar with doing. They're gonna measure, make sure they're at the right length. And then I'm all set, but if we needed another pack, they would let you know if we weren't all the way dry yet, that we needed more, but we're good. Okay? So now our tooth is dry. The picture that you see there, so if your office doesn't do a ton of root canals, they might not have the paper points. So the other option is that they would take files and take a cotton roll or the pellets, and they would wrap it around the files. So now we're going to take another working x-ray with the master cone. So we're going to place the gutta percha inside the tooth, and we're going to take a picture to make sure that it's all the way to our apex. So I'll measure it to make sure we're to 18. Now I have more than one canal, so I'm going to need another piece of gutta percha. So you're going to put one piece in each canal. That picture up there shows you a single, that's an anterior tooth, looks like a central incisor. So there's just one.
Say that again. We're not closing yet.
It's too tight for me to put that in. Okay. So now we have our gutta percha in each of our canals. We're going to take another working film. So the assistant's going to fold this back up. We're going to bring that back up. As we're working, we'll let the patient know to raise their left hand if they feel like they're filling up, and we can suction. But certainly when you take an x-ray, it's a good time to get the suction and suction out the patient if
So-
filling up.
Is the gutta percha another way to dry it?
No, the gutta percha is a rubber-based compound that's going to take the place of where the pulp once was, so it's going to fill the pulp space.
Okay, so this is the second x-ray you take on the patient after you've already done the working file? You did that
Yep.
x-ray analysis? Okay, I just wanted to-
So this is right before we're going to get ready to finish and fill. So we want to take a picture with the gutta percha in the tooth to make sure it's where we want it to be before we cement it and seal it in. Okay, so that's in. We get the PID, we take the picture. She comes and gets the doctor, I come back. We fold this back down. And there's our master cone radiograph. Okay, so that looks good, it's all the way to the apex, we're ready to proceed. So now, the filling part of this is called the obturation. Okay, we're gonna obturate, we're gonna fill this too, okay? So we have the gutta percha in there. They might opt to pack more gutta percha in there vertically, okay? Again, this technique kind of depends, it's something that I don't wanna say that it's more done by the general dentist, but you're gonna place a size gutta percha in there appropriate for whatever files you get up to, right, for the width of that canal. So if you need more gutta percha to fill it, you're gonna do the vertical condensation, so you'll pass the spreader. And then she's gonna pass me another piece of gutta percha. And if you look at that picture up there, so they'll use as many pieces of gutta percha as they need to fill that space. And again, that's lateral condensation. So we're filling this up laterally. How do I know which one is the spreader and which one is the plugger?
Plugger's flat.
Right,
Or-
so the spreader has that point, has a pointed tip. We're good, I'm good. So you'll go back and forth with the spreader and the gutta percha until the lateral condensation is complete. And then they might wanna take a radiograph of that, depends on the SOP. And then we're gonna get ready to heat it. Now, these are endo-E's, right? So you put these on a film, on a mandibular film, because it's a little bit of a cushion for the mandible, for the patient's floor of the mouth when you're taking x-rays. Some endo offices will have these on the side of the tray to help to line up their pluggers or condensers, okay? So now we're gonna let the patient know that they might see a little bit of smoke and smell a little bit of a clovey smell, and it's just us heating the material. And the assistant will often grab the suction so that as it produces that smoke, see that smoke there? She's suctioning that up so that the patient smells a little less of that. Now at this point, if you remember from the PowerPoint, I showed you the touch and heat. Do you remember that instrument called the touch and heat? So that was one that it looks kind of similar to like the plugger or the spreader, and they put that in the tooth, and that helps to continue to heat the gutta percha that's in there, and then you're gonna pack it. So you'd go back and forth between that. If you don't have that, they would need to continue heating this to be able to melt that gutta percha. Okay. Now this is the vertical condensation. You're vertically condensing and packing that gutta percha. Okay. Now if they had that Aptura, that machine that I showed you, is like the had the little pellets that you squeeze it. It's like a gun, and it fills with gutta percha. They'll do that for the upper coronal part. Okay. So now we're going to get ready to place the temporary with Cavit and a cotton pellet. So we'll have the assistant will do this part. So you can move into the operator's seat. A lot of times at this point the dentist starts writing up the chart. So the assistant's going to put a pellet in there and then place her Cavit. And remember, the other assistant might have already set this up for her. So there's her Hershey Kiss sheet. And then our alcohol and the applicator so she can smooth that out. So she's going to smooth that out. I'm going to make sure this is nice and clean. Okay, and then she's going to get ready You'll have to take your lights might feel a little bit of pressure. I usually breathe a huge sigh of relief once that is off. And then she's going to take a look at that, see if she needs another. She needs to smooth that out any more. And then she's going to check the bite. Okay, now the bite looks good. So remember that sometimes they will take that tooth completely out of occlusion. So they'll use like a diamond football burr and smooth that tooth down, so when they bite top and bottom together, that tooth has no chance of hitting at all. Because even though that tooth has no pulp now, so they'll never feel temperature, they'll never feel hot or cold in there, that periodontal ligament still surround those roots, so it's like a sprained ankle. So if they bite down on that tooth, it can still be uncomfortable, okay? So now she's gonna take her final x-ray. She could do that with the Endorite, or she could do it with just a regular right instrument. And there's the final bill, so we can see that they got a purchase right to the A to C.